You're watching Medically Speaking with me, Meenakshi Upreti. I have Professor Dr. Anup Kumar with us. He is the HOD of the Urology Department at the prestigious Safdarjung Hospital in the national capital. Thank you first for joining us on NewsX. Sir, as far as coronavirus is concerned, all of us were taking a big sigh of relief. We thought COVID is gone. It's over. We've thrown away our masks. We have resumed normal life. Perhaps we should be more cautious. But right now, India is worried once again. The cases are increasing in China. Cases are increasing in South Korea. What's happening in China? Of course, over 2 crore people, as we had heard, were isolated. The Chinese government had cracked down. COVID, of course, becoming a big headache for them. Does it mean anything for India? Do we need to worry at all, sir? First of all, help us understand that.
So, good evening, Meenakshi. Thank you for inviting me today. Definitely, this is a matter of concern for India, and our health minister already has expressed his views that India is already taking all the precautions because the cases in China has increased rapidly over the last few weeks. And not only in China, we look at America, you look at the UK, Finland, some of the European countries, the cases have increased from 60% to 100%. And as we know, this is because of the new variant of Omicron, which is known as BA.2. That is causing this rapid rise in the cases. So we have to be careful at this particular moment because we remember when we had the third wave, that time the Omicron started from South Africa. And within a span of 4 to 6 weeks, it came to India and started rising in a huge number. So it's a matter of concern, and our government is already on the toes, taking all the precautions and whatever patients, the passengers are coming from those countries, they're going to use all those restrictions like testing. If quarantine is required, they will also put the passengers on quarantine. And of course, they've given us the 5 mantras, the tracking, testing, treating, vaccination, and to follow the COVID appropriate behavior. So these 5 will continue, but yes, they have to impose some more restrictions for the travelers who are coming from these countries which are facing this new wave.
Right. And so what is this BA.2 variant? Help us understand in layman's term. Have we seen this variant in India? What are the manifestations? What are the symptoms of the variant? Help us understand more on the same.
This BA.2 variant is the original Omicron is BA.1. And as we know, in this original Omicron variant, in the spike protein of the virus, almost 30 to 40 mutations happened, due to which the virus was escaping our immune mechanism. That means, in simple words, our antibodies were trying to neutralize the virus, the beta variant earlier, which was responsible for second wave. Now, this Omicron variant could escape that antibodies and can attack us and can invade our body, due to which it was highly contagious. This BA.2, it is being considered that more contagious than BA.1. That means it can spread more rapidly from one host to other host. It can escape the immune mechanism of the body. But so as per the WHO, it is variant of interest. That means variant of interest when the virus is rapidly transmitting from one place to other place. But whether it's a variant of concern, that means whether it is causing more serious disease, complications, mortality, that is still the data is evolving.
Okay. But we don't rightly said if it's still a VOC, a variant of concern or not. But what about, how potent this variant is? We, of course, know that fortunately, Omicron was less lethal than Delta was. We've seen, less number of deaths, less number of hospitalization. Do we know anything about this BA.2 variant when it comes to the lethal nature or perhaps the seriousness of the disease it causes?
So whatever cases data we have now gathered from different countries, it has been seen that it is as contagious and probably more contagious than BA.1, which is the original Omicron variant. The seriousness or the morbidity of the disease is not as high as the beta variant. That is something which is good news for us. But yes, those who are high-risk patients, as we said earlier, those who have some comorbid conditions, immunocompromised, like kidney transplant, on chemotherapy drugs, hypertension, diabetes, COPDs, these still have the high risk. If they contract this variant, they can have serious complications.
So the comorbids are, of course, at risk as always. What about India? Why do you think we've had such a great response? Would you say that it's the vaccination cover, also the fact, We had sero surveys which showed our immunity was much stronger. The fact that a large number of our population had already been exposed to Delta and of course to Omicron as well. What really has worked really in India's favor, what has kept us insulated from seeing a rapid spread of this variant? One, it hasn't come to India, but if it does, what do you think is going to work for India?
So definitely there are some plus point for India. One is the vaccination drive. We know more than 180 crores have been vaccinated. Now we started the vaccination for 12 to 14 years of children also started the vaccination for all the people more than 60 years, whether they have COVID conditions or not. So the vaccination drive has definitely helped us, because whatever immunity we get, it will definitely give us some protection against any variant which we have. But again, this is only one aspect. If we have to fight against this new variant, we have to have the COVID appropriate behavior in place. And remember, that was the only thing which was there before vaccination. And now we have vaccination plus this COVID appropriate behavior. Together, we can use both these measures to fight against this disease. And that's why our health minister has said that they are going to start a genomic sequencing very soon for BA.2 variant. Because we don't know whether this virus is there in India or not, but by the genomic sequencing only we can find out that whether it's there in India or not.
All right, genomic sequencing, you rightly said, is going to happen very, very soon. The health ministry is taking some steps in the right direction. Of course, we do hope that this variant is kept under check. Certainly, the vaccination drive has worked in India's favor. As of now, not much to worry about. Don't worry, be cautious. That's the advice coming from Dr. Kumar here. Thank you, sir, for joining us on NewsX.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.